So Epworth Geelong is a new private not-for-profit hospital in the Geelong region. It was opened in July 2016. It's a hospital with 170 inpatient beds, provides a wide range of acute rehabilitation, medical and obstetric services. So we've been open for 14 months now, and we had a commissioning and build phase of around about 2 years. Brookfield Multiplex was our lead contractor who undertook the construction with us. A project that was generally very successful, on time, on budget. Our commissioning strategy also worked really well. We started with 400 staff, predominantly 90% local staff from the Geelong region, so it was a really good opportunity to provide further employment for people in the Geelong region as well. So with those 400 staff and with the services that we've been opening up since July 2016, we've been providing a new service opportunity for people of the Geelong and the Bowen region. Epworth as an organisation, not just at Epworth Geelong's, decided to introduce the point of care system. The OneView system has been implemented. We've now got 1,500 terminals throughout all our Epworth campuses, and that was also implemented at Epworth Geelong. The point of care terminal has really sort of got, it's a shared device for the patients, for the doctors and nurses, but also for our support staff to utilise. So the patients utilise the point of care device really around information and education, but also about entertainment in terms of access to TV and games and those sorts of things, just to keep them, I suppose, occupied, but hopefully also educated while they're with us as a patient. Doctors and nurses obviously use it for a clinical perspective, so there's the security around the point of care device in terms of accessing clinical information. The doctors and nurses can access results, they can access previous histories, and they've also got the ability to refer on patients to rehabilitation, for example. But also our support services staff utilise the device as well in terms of enhanced workflow. Again, for example, when a patient's discharged, the nurse is able to actually press the room ready button on the point of care device. That sends a message to our environmental team, and they know that that room is ready for the next patient. Our community engagement was really about them understanding who Epworth was as an organisation. Epworth predominantly has been a healthcare organisation that's focused on services in the Melbourne region. Epworth Geelong was really the first campus that was created outside the Melbourne region. So we did a lot of community engagement, but it was really about educating who Epworth was. Were we a public provider? Were we a private provider? Of course, we're a private provider of services. What was our background? We're a church-based, not-for-profit organisation. So who is the organisation that our local community is now putting their trust in terms of healthcare provision? So over a number of years, and even today, we're still doing community presentations, telling people about the hospital, but also telling people about Epworth, the organisation, and telling them about our philosophies around our staffing, our values and behaviours, and what it's like, what it should be like to be a patient at Epworth and really get great clinical care, but also hopefully have an outstanding experience in addition to that. So look, our partnership with Deakin University is very strategic and very important. The hospital is actually co-located with Deakin University, so we bought land right next door to the university campus. The Warren Ponds campus has the Deakin Faculty of Health and also the School of Medicine located there. And in fact, some of our facilities in the hospital itself have been partially funded by Deakin University, focused around supporting education of medical students, of nursing students, allied health students. And also over time, I think we believe our partnership with Deakin will evolve into research opportunities as well. So it's a very, very important. Epworth has relationships with a number of institutions, but certainly the one with Deakin University in Geelong is very important, that we work with them in terms of educating the medical workforce, the nursing workforce of the future, and really creating a connection with those people that when they do graduate and finish their training, that they might want to come back to Epworth at a later time and work in our hospital as a trained clinician. So the benefit of an event like this one is really about the opportunity to learn, to understand other people's experiences, what lessons have worked for them, what lessons have not worked for them, and really it's also a great opportunity to network with peers. I've already met a couple of people today who I'll be following up with about sort of things they're doing in their organisation, and that have the potential to be applied at Epworth and maybe Epworth Geelong as well.